So this week we are going to talk about the GI and biliary systems. When we're talking about the GI system, it's broken into sections. So the upper GI tract includes your esophagus and your stomach. The middle is your duodenum, jejunum, and ileum. And then the lower GI tract is your large intestine, which includes your ascending, transverse, and descending colon, as well as the anal canal. One of the things that makes the GI system unique is that most of it contains a mucosal layer. This is the innermost layer of tissue of the GI tract. It produces a mucus, and what that does is it lubricates food and digestive contents as they move through our GI tract, as well as protects the interior of our tract. So this lining is not in the mouth, in the esophagus. It's everywhere after pretty much we have stomach acid that comes in contact. Because if we didn't have the mucosal layer, the stomach acid could erode through our tissues, cause complications. The epithelial layers have a rapid turnover rate, so they actually replace themselves every 4 to 5 days. This means that if we injure these areas, they can heal pretty promptly. There's some general signs and symptoms that go along with GI dysfunction. They're not usually specific to anything in particular, right? But they do tend to give us some indication that something's wrong. The first one would be anorexia. So not the eating disorder, just the general term means a loss of appetite or no desire to really eat. It's often associated with our emotional state, such as people who have depression or anxiety, fear. They often don't feel like eating at times. It can be a side effect of medications or a disease process that's going on. Nausea is whenever someone has the conscious or thoughtful sensation that they're going to vomit. So it's actually a stimulation of part of the brain in the medullary center called the vomiting center. It's usually preceded by a lack of appetite or anorexia. It can be triggered from a variety of different pathological methods. So for instance, if the duodenum in the intestinal tract gets pressure because of a buildup of contents, it can do it. Scents can trigger it. It can be a side effect of medications or things like that. Usually nausea, it can be followed by emesis or vomiting, right? That's whenever the GI tract does a forceful expulsion of the contents of the stomach. What they throw up is called vomitus. Usually they're nauseous before it happens. It's considered to be a protective mechanism. So for instance, the GI tract just regulates or says that something's wrong and that it's unsafe, so it goes ahead and forces its contents out to try and protect the rest of the body. It can be due to noxious agents, overdoses, toxic side effects, increased intracranial pressure, putting stimulation on that medullary center, a variety of different things. Constipation is where there's difficult or infrequent defecation going on by the patient. It's any change in their normal bowel habits where there's a decrease in the number of bowel movements. So it's important to understand the patient's normal to know if there's a decrease from them. It can be caused by sedentary lifestyle, a low-fiber diet, or even psychosocial concerns like depression. Diarrhea is the opposite problem, where there's an increase in frequency and it's often more fluid and a higher volume of feces. They can also complain of abdominal pain. The exact location may determine where their pathology problem is located at. GI bleeding is also another concern for GI complications. Right, there's different ways it can present, and basically it depends on where the bleeding is occurring and whether it's mixing with digestive contents or not. If someone throws up and there's blood in the vomitus, that's called hematoemesis. Hematochezia is wherever there's bright red blood passing from the rectum. If it's bright red, that tells it hasn't been through any of the digestive process, so it must be part of the lower GI tract, like the colon. Melena is a black, sticky, tarry stool that's often very foul smelling. This happens whenever blood goes through part of the digestive tract. It turns black and makes it very stinky. One of our common problems with the GI tract is an obstruction. So that's where anything is causing some type of blockage of flow of our GI contents, also known as chyme, through the intestinal tract. This can be caused by different medical conditions. Things that can cause GI tract obstructions are conditions such as interception, volvulus, constrictions from adhesions or an ileus. These are some images of the different examples. So a volvulus is essentially when the bowel twists on itself, kind of like if someone's making a animal balloon out of those long tube-shaped balloons, and they have to twist the different parts to create the balloon animal. So it could happen in the GI tract as well with the intestines. A hernia is where we have a loop of intestinal tract that is pulling through another structure such as the abdominal wall, and this section is at risk of getting pinched off, and then abdominal contents can't flow through there and they'll be obstructed. Interception is where a loop of bowel is being pulled in on itself. So where it overlaps, then the lumen's smaller and peristalsis doesn't occur, so it can be obstructed there as well. Patients will often complain of crampy and colicky pain because as peristalsis tries to move contents through these areas and they can't, the wave will hit, cause pain, and then as it moves or calms down, peristalsis stops, the pain will not be as intense, so it kind of comes in waves. They will often also have a vomiting because since things can't move forward through the GI tract, they'll back up into the stomach and eventually cause vomiting. And then their abdomens will usually be distended, meaning that they look fuller and more round than usual. We also have disorders of our esophagus. So the esophagus connects our mouth to our stomach. Dysphagia is whenever we have difficulty swallowing. It can be because of damage to our cranial nerves. Achalasia affects the lower esophagus, and what it is it's a failure of the sphincter to relax, so food can't leave the esophagus and pass into the stomach. It stays in the esophagus instead and makes the patients at high risk for aspirating or choking on the food and having it go into the lungs instead. Gastroesophageal reflux disease is also called GERD. It's a very common disorder. It's whenever we have a reflux of our stomach contents up into our esophagus, and then it causes irritation and problems there. It's caused by a lower sphincter of the esophagus that won't close properly. All right, so something is going on where this sphincter is considered incompetent. Things can also cause complications to affect GERD. People wear too tight of abdominal clothing, all right, things like corsets, for instance. It's going to put pressure on the sphincter so it can't close. People who are pregnant or obese because they have a larger stomach or abdominal content area, that's going to put pressure on the stomach and also make it hard for this esophagus to close or sphincter to close the whole way. Bending over can also cause problems because it increases the intra-abdominal pressure to keep it from closing as well. Signs and symptoms of GERD include heartburn. That's the most prevalent one. Patients usually say it's worse after 30 to 60 minutes after they eat a meal because that's when their stomach acid content increases. They will also have more burping or belching than usual. They describe the pain as epigastric, which means above the stomach area, or even retrosternal or behind the breastbone. It can radiate up into their throat, shoulder, or back for referred pain. Symptoms are going to get worse if they lay down or increase the intra-abdominal pressure because that makes it more likely for those GI contents to come up into the esophagus, and that's when they trigger the symptoms. This is just a close-up view of that esophageal sphincter that's incompetent in GERD. The problem with GERD is that if we leave it untreated, all right, remember the esophagus itself does not have mucus to protect itself from the acid of the stomach. So if that acid keeps coming back up into the lower esophagus, it's going to erode it away and cause damage. The persistent reflux causes damage over and over again, and it can lead to a condition called Barrett's esophagus. And that's where we actually see cellular changes go on in the tissues of that esophagus because of the chronic inflammation and irritation that's going on. These can lead to strictures where scar tissue forms and the esophagus gets narrowed, or even esophageal cancer if left untreated. So this is just an endoscopy or scope view of somebody with Barrett's esophagus. Our tissues should be nice and light pink. The reddened areas are where we're seeing changes go on from that constant exposure to the stomach acid. Alright, so next we're going to talk about the mucosal layer of the gastric contents, or your stomach in particular. Its job is to give us some protection from all the acid, or the hydrochloric acid and pepsin, that are in our gastric contents. Our lining is usually impermeable to acid because we have this mucosal barrier. If we have too much acid or hydrogen ions secreted and not enough balance with bicarb, right, then the mucosa is going to get in trouble. Right? Changes in blood flow is also going to put us in trouble. So if we have a decrease in bicarb production because of a change of blood flow, that is going to cause an increase in acid. And then that acid can't balance out with the mucosal layer, and it's going to get against our tissue walls, and this can lead to ulcers to be developed or erosions. Prostaglandins are one of our chemical messengers that we have triggered for our inflammation, pain response, and other things. They also increase bicarb production. Right? So this can enhance our mucus production and help cause us some protection. Some medications that can damage our stomach because they inhibit our bicarb secretion, and they also block prostaglandins, are aspirin and NSAIDs. So aspirin, the medical abbreviation is ASA, and NSAID stands for non-steroidal anti-inflammatory medicines. These are our very common over-the-counter pain relievers. So if people take these longer or more than are prescribed, then they're going to cause a decrease in their bicarb production and lead to that acid to get against our stomach wall and cause gastric irritation. Right, we have two major reasons for gastric irritation to occur. One are these medications. The other one is a bacterial infection called H. pylori. Gastritis is when we have irritation and inflammation to the gastric mucosa, or the cells along the stomach lining. This can be anything from causing edema to actual bleeding ulcers or hemorrhagic erosion. Right, patients will often complain of heartburn, and they could even get as serious as vomiting blood or hematoemesis. Some acute causes for it include excessive alcohol intake, poor aspirin use, or even bacterial toxins. People can also have chronic gastritis, and this is usually linked to the H. pylori infections or even autoimmune disorders. Peptic ulcer disease is where we have a break or an ulceration in the lining of our stomach tissues. All right, we don't exactly know why, but something has disrupted that balance, and the stomach acid has gotten against our gastric wall and is now causing an erosion. Right, there are people with risk factors that increase their incidences of peptic ulcer disease. These are people who have H. pylori problems, take NSAIDs, alcohol or smoking without moderation, advanced age who are more prone to get these. Chronic disease and chronic stress also can lead to ulcer development. H. pylori is short for Helicobacter pylori. It's a bacteria with a flagella that allows it to move through the stomach and get into the mucosal layer. What happens is they produce ammonia, and that reduces the acidity of the stomach contents. That then allows our acids to get against our stomach wall. They also produce an enzyme and toxins that interfere with our stomach protection mechanisms, and that's how they can survive, because they don't get killed off by the acidic environment. All right, once they're in the stomach wall, right, they cause an intense inflammation that can cause damage. Here's some images of how some of the H. pylori infestations can look. All right, next we'll pick up with diagnosis and treatment of H. pylori infections.